Good afternoon, dear students. So, on Saturday, we have discussed about the Barrow 3-item motor fitness test, and today we have proceed further with the Rikli and Jones senior citizen fitness test. Rikli and Jones and senior citizen fitness test both are the same names. So sometimes question arrives like Rikli and Jones, explain Rikli and Jones test. So this is senior citizen test, or sometimes it will be senior citizen fitness test. So you know that they are talking about Rikli and Jones only. So now we start our topic. Even in old age, people want to fit and be able to continue to do their work without pain as long as possible. It requires proper fitness during old age. In the beginning, there were not enough tests to assess functional fitness. This test is also known as Fultron functional test of senior citizens. Rikli and Jones developed the senior citizen test in 2001. So, Rikli and Jones invented senior citizen test in 2001. This test has proved to be beneficial for senior citizens. It helps the early identification of at-risk participants. Along with this, it is significant to plan safe and effective physical exercise program. Physical exercise program for senior citizens, because individuals' health and fitness level can be known better with the help of this test. The senior citizen fitness test include chair stand test, arm curl test, chair sit and reach test, back stretch test, 8-foot up and go test. So these are the tests who are specially designed for senior citizen by Rikli and Jones in 2001. First test is chair stand test. First, we have to discuss about the purpose. The main purpose of this test is to measure the lower body strength, particularly the strength of legs, which is usually required for various tasks such as climbing stairs, getting in and out of vehicle, bathtub or chair. Equipment required: a chair with a straight back and a seat of at least 44 centimeter and a stopwatch. Instruction to participate: the participant should sit in the middle of the chair. He should keep his hands on the opposite shoulder, crossed at the wrist. The feet should be flat on the floor. His back should be erect. Repeat standing up and sitting down for 30 seconds. These are the instruction for participants, what they are supposed to do. Now procedure: keep the chair against the wall. The participant sit in the middle of the seat. His feet should be shoulder width apart and flat on the floor. The arms should be crossed at the wrist and held close to the chest. From the sitting position, the participant should stand up completely. A full stand from sitting position. When the time is finished, the final stand is counted in the total. Now, scoring. The score is the total number of completed chair stand during the given 30 seconds. The following table for the recommended ranges for chair stand test. The table is different for women and men. In this table, they have framing 4 columns, in which age, then below average, then above average. So what are the score is for below average, average or above average according to the age. If a senior citizen age is from 60 to 64, so below average is 15, average is 15 to 19, and above average is more than 19. And as in case of women, age is 60 to 64 age, below average is 12, average is 12 to 17, and above average is more than 17 or 17, till 17 or more than 17. So this is the ages as up to 94, like 60 to 64, 65 to 69, then 70, 74, likewise up to 94, and they have mentioned the different parameters. Now next, so first test is chair stand test, and this is for measuring this is for measuring lower body strength of senior citizen. Next test is arm curl test. The arm curl test is a test to measure the upper body strength. So you have to remember this thing, that which test is for which, measuring which body part. So arm curl strength is for measure the upper body strength. It is a part of the senior citizen fitness test. It is designed to test the functional fitness of aged people. Purpose: the main purpose of this test is to assess the upper body strength and endurance which is required for performing household and other activities involving lifting and carrying things. Equipment required: a 5-pound weight for women and 8-pound weight for men, a chair without arm, and a stopwatch. Now procedure. The aim of the test is to find out the maximum number of arm curl that one can complete in 30 seconds. Arm curl is performed with the dominant arm side. The participant sits on the chair, hold the weight in the hands using a suitcase grip. It means the palms should be facing outward. The palm is facing towards the body. The arm should be in a vertically downward position. The upper arm should not move, but lower arm should move freely. Curl the arm up through a complete range of motion, gradually keeping the palm up When the arm is lowered through the complete range of motion, gradually return to the starting position. The arm should be completely bent and then completely strengthened at the elbow. This complete action should be repeated by the participants as many times as possible with 30 seconds. So this test is also for 30 seconds. Now scoring. The score is the total number of arm curl performed within the given 30 seconds duration, and here also table which you have shown in the screen. So next test is chair, stand and reach test. In chair, stand and reach test, first we have to discuss about the purpose. The purpose is to assess the lower body flexibility, which is important for good posture, normal joint pattern and various mobility tasks such as getting in and out of the bathtub or car. Equipment required: ruler, a chair with straight back approximately 44 centimeter high. Procedure: the participants sit on the edge of the chair, keep against the wall for safety purpose so that it will not move and it will not drag, so that the senior citizen will fall down or got injured. The one foot should remain flat on the floor as you seen in the picture, while the other leg should be extended forward with the knee in straight position. Heel should be on the floor and ankle should be bent at 90 degree. Place one hand on the top of the other with the tips of the middle finger at the same level. Instruct the participant to inhale and then as he exhales, reach forward towards the toes by bending at the hip. His back should be straight and head up. Avoid any jerk or bounce and never stretch too much. Keep the knee straight and hold the reach for 2 seconds. The distance is measured between the tip of the finger tips and the toes. If the fingertips touch the toes, then the score is 0. If they do not touch, measure the distance between the fingers and the toes. The scoring will be negative score. If they overlap, measure the distance or it will be positive. That will be in minus and that score will be positive score if you touches or you crosses the toe tip. Scoring. The score is noted down to the nearest 1.5 inch or 1 centimeter as the distance reached either a negative or positive score. So in this also a table should be there, so as you seen in the picture. So this is all about the chair and sit reach test. Chair, sit and reach test. Next is back stretch test. Purpose: this test help to assess the upper body flexibility, which is essential for a person to perform various jobs such as combing hair, putting on overhead garment, reaching for a seat belt, etc. Equipment required: a ruler. Procedure: this test is performed in a standing position. Keep one hand behind the head and lower it down gradually over the shoulder and reach as far as possible at the middle of your back. As you must have seen in the picture, same position should be followed. Your palm should touch your body and the finger should be downwards. Then carry your other arm behind your back with palm facing outward and fingers facing upward, and try to reach up as far as possible in order to touch or overlap the middle finger of the other hand. Fingers should be aligned. Measure the distance between the tips of the fingers. If the fingertip touch, then the score is 0. If they do not touch, then measure the distance between the fingertips. This is also a negative score. If they overlap, measure the distance in positive. Let the participant practice twice and then 2 trials will be conducted. Scoring: record the best score out of 2 trials of the nearest centimeter or 1.5 inch. So in this also table should be there. And the last is 8 foot up and go test. This test is conducted to assess coordination and agility in the aged people. Purpose: this test helps to evaluate speed, agility and balance of a person while moving. These are important factors in performing jobs which require quick moving, such as getting off a bus in time, to answer the phone call, etc. Equipment required: a chair with straight back, approximately 44 centimeter high, a stopwatch, cone, marker, measuring tape, and an area without any hindrance, a plain surface. Procedure: keep a chair next to the wall and place the cone marker 8 feet away in front of the chair. The participant is initially completely seated, hands resting on the knees and feet flat on the ground. On the command go, stopwatch is switched and the participant stands and walk. No running. They have to walk. They should not run. Keep in mind this thing, that they have to walk only. They will not run. Walk as quickly as possible towards the cone. Turns around and return to the chair to sit down. This is noted as he sits down on the chair. Two trials are given per participant. Scoring: the best trial is recorded to the nearest 1/10 second. The table shows that the recommended norms or ranges in seconds in different groups. And the last is 6 minutes walk test. The 6-minute walk test is designed to test a functional fitness of senior citizen. Purpose: this test helps to assess the aerobic fitness or aerobic endurance of a person, which is an essential component for walking distance, stair climbing, shopping, sightseeing, etc. Equipment required: a measuring tape and a stopwatch. Procedure: the walking distance or course is marked, that is 45.72 meters or 50 yards in a rectangle area. The area should be 20 by 5 yards of 5 yards with cones placed at regular interval to indicate the distance covered. That they have to put cones in every 5 yards, like 4 cones should be there, and they have to mark the area in every 5 yards. Efforts are made to walk maximum distance as quickly as possible in 6 minutes. A practice trial is given to the participants. He may also stop any time if he desired so. Now the scoring. The total distance in 6 minutes is recorded to the nearest meter. You must have seen in the picture. So this is all about the senior citizen fitness test or Rikli and Jones test. First is chair stand test for lower body strength. Arm curl test for upper body strength. Then chair sit and reach test for lower flexibility. Back stretch for upper flexibility. Then 8-foot up and go test for coordination and agility. And last is 6-minute walk test for endurance. So these all tests are for senior citizens, and which is very important. Now next we have to measure the administration of computation of fat percentage. Slater-Lohmann children skin fold formula. Though in this they have to measure the triceps and calf skin fold, and the equipment is skin fold caliper. First is tricep and calf skin fold for male 6 to 17 years. In this, body fat percentage is equal to, formula is given, and for females is different formula is given. First of all, ensure that the adult or child right arm is hanging loosely. Stand behind the subject and pull a vertical skin fold about half an inch about the already marked side, with the thumb and index finger pointing downward, centering the mark. Keep the skin fold caliper perpendicular to the length of the fold, centering the mark. Then release the caliper and note the reading on the dial after approximately 4 seconds. Record the measurement to the nearest millimeters. This is of triceps skin fold. Now calf skin fold. The calf skin fold is measured on the inside of the right leg at the level of maximal calf girth. The right foot is placed flat on the elevated surface with the knees flexed at 90-degree angle. The vertical skin fold should be grasped just above the level of maximum girth, and the measurement is made below the grasp. The measurements are taken in millimeters. So these are the procedure to measuring tricep skin fold fat measurement percentage and calf skin fold fat percentage. Now we will summarize the chapter. First is motor fitness test. In motor fitness test, we have 8 parameters. That is, first is modified push-ups for female, push-ups for male, push-ups for boys, then standing broad jump, then shuttle run, then 50-meter dash, 50-meter sprint, 600-meter run and walk, flexed arm sit-ups. So these are the motor abilities, motor fitness test. Now we are talking about general motor fitness test or Barrow 3 item general motor ability test. In this is invented by Dr. Harold M. Barrow in 1953. 3 items will be there: standing broad jump for measuring leg strength, zigzag run for measuring agility and speed, medicine ball throw for measuring arm and shoulder strength. Then next is measurement of cardiovascular fitness. In cardiovascular fitness, 2 tests are there. First is Harvard step test and second is Rockport 1 mile test. In Harvard steps test, 20-inch box should be there. They have to step up and down for 5 minutes. Approximately 150 steps should be there, 30 steps per minute, and the formula is there. So we should be calculate the fitness, the strength of your heart and lungs. Next is 1 mile Rockport test. In 1 mile Rockport test, maximum volume of oxygen, VO2 max, should be measured. In this they have to walk for 1 mile. 1 mile is approximately 1609 meters. So we need 200 meter or 400 meter track for this. And subject is complete 1 mile by running or walking. And then they have to check their heart rate per minute by ECG or EEG, and then we will put a formula to calculate VO2 max. Then computation of fitness index. Duration of exercise in second into 100. This is the formula of computation of fitness index. 5.5 into pulse count of 1 to 1.5 minutes after exercise. Calculation of fitness index score. Fitness index score long term is equal to 100 into test duration in second upon 2 into sum of heartbeat in recovery period. Fitness score, this is for long term, and for short term, fitness index score for short term 100 into test duration in second upon 5.5 into pulse rate count between 1 to 1.5 meters after exercise. So this is for short term. Here the fitness index score is calculated with short term formula. For example, the total number of test duration for a girl was 300 seconds and the number of pulse count between 1 to 1.5 minutes was 80. Then her fitness index score will be 100 into 300 upon 5.5 into 80. So 30,000 upon 440 is equal to 68.18. So it's 68.18. So it's average. Because here is the index show, if your score is 90 for male and 86 for female, it's excellent. If your score is 80 to 90 for male and 76 to 85 for female, it's good or average, above average. If your score is 65 to 7.9, 79.9 for male and 61 to 75.9 is average. And if your score is 50 below 55 for male and 50 for below 50 for female, it's poor. So it means your rating should be according to the index. Now last is Rikli and Jones senior citizen test. This test is for senior citizens. Here 6 items should be there. First is chair stand test for lower body strength, then arm curl test for upper body strength, then chair sit and reach test for lower body flexibility, then back stretch test for upper body flexibility, then 8-foot up and go test for coordination and agility. Then last is 6-minute walk test for endurance. And these all 6 tests are for senior citizens. They are fit for their daily routine work or not. So this is very important for senior citizens. These tests are good for them, so they should know their range of ability, and so that because of that range of ability they can do the work efficiently, and they may not feel any hindrance or problem, and it helps the early identification of at-risk participants. Along with this, it is significant to plan safe and effective physical exercise program for senior citizens, because individual health and fitness level can be known better with the help of this test. So this test is beneficial for the fitness of senior citizen. Thank you and have a nice day.